When it comes to Canada's pandemic response, well, we outperformed most other countries that are part of the G10, and that includes the United States, the UK, Japan, and France. When it comes to case rates, Japan came in with the lowest figure of 20,600 per 1 million people. Canada was just over 82,000. France was the highest of all 10 countries. Japan also had the lowest COVID death rate at 156 people per million, with Canada next at 919. The U.S., that was the highest, with more than 2,700 deaths per million. Canada has the highest two-dose vaccination rate. As of February, 80% of Canadians were considered fully vaccinated. The lowest figure was the U.S. Only 64% of Americans are what we would consider fully vaccinated with 2 doses. Joining me now to discuss is the co-author of this study, Dr. Fahad Razak. He's a member of the Ontario Science Advisory Table and internal medicine physician at St. Mike's Hospital. Doctor, good morning to you. So you led this study. Did anything surprise you?
Yeah, hi, good morning. Actually, we were quite surprised. So there's a lot of informal analysis to suggest that even though the experience of the pandemic was brutal for all Canadians, this was a tough global issue and comparison has some value. And in that sense, we did relatively well compared to these countries that share a lot with us. They share similar economic and political models. They have similar population structures and health systems. And, one number that's really striking to us is that if we had followed the US course, we probably would have had about 70,000 more Canadians die in the last couple of years. This is up to the Omicron wave. That's an enormous number. That means most of us would probably personally know an elderly family member or someone who has an illness that would have died in Canada if we'd followed the US course that's alive today.
Well, let's talk a little bit more about that course. To what do you attribute Canada's low death rate? And I also want to ask you about Japan, because that country had one of the lowest death rates per capita, yet they didn't have the same stringent lockdown measures that we did.
Yeah, absolutely. So I think there's 2 things to take away from this. The first is that if we try and look at what was done in Canada and what may have contributed to this, 2 things really jump out. The first is that we had the highest 2-dose vaccination rates. We know vaccines are enormously protective against really serious illness. The second is that we had not only fairly strict, but we had persistently high public health measures throughout the pandemic, the second highest of any country. Those 2 things together probably explain how well we did. Now, we have this exception of Japan. So Japan had really very different stats than every other country in the G10. And it's a bit of a mystery, and it's something that scientists are actively studying. It could have to do with a range of factors, including some genetic differences, the fact that they may have been infected with coronaviruses before COVID-19, which has given them some immunity. They're very used to wearing masks in public. Prior to COVID-19, they did this all the time. So it may be that when it was required here, they quickly were able to do it effectively. So a range of explanations, but nothing clear from this paper.
What lessons do you think we've learned from what you discovered in your study?
Look, we had a brutal couple of years here, so this was an unprecedented challenge for Canadians, but they rallied. So they had the highest vaccination rates. They really tolerated these very strict and difficult public health measures. And we're starting to see that probably there was an enormous benefit because of that. And I think that's an important lesson to take forward as we go through this next phase of the pandemic. There's certain things that indicate that Canadians are not as engaged now. So, for example, our 3rd dose booster rate is now middle of the pack, not at the top like it was for dose 1 and dose 2. And a lot of public surveys say people are very disengaged with the fact that the pandemic is still continuing and challenging and making people sick. So I think we need to learn from those successes and use that as a launching point as we go forward.
Yeah, and Doctor, when you say the next phase of the pandemic, can you describe the characteristics of that? Because I think you sort of touched on this around people not getting that 3rd shot. A lot of people, I don't need to tell you, they're just done with it.
I get it, absolutely. What we've gone through these last couple of years, I understand that frustration and exhaustion and wanting to be over it. But what I say about this is that this is not a human adversary. It's a virus, and it exploits exhaustion and complacency. And so we just need to be careful. We're heading into a summer stretch where numbers have gone down clearly. That's fantastic. But the fall is potentially a challenging time of year again. Cold weather, people indoors, other variants on the rise. And so do everything you can to protect yourself, your loved ones, and those around you. That's what I would say. That includes things like vaccination. And if there is a need for public health measures, just know that evidence like this suggests that they were enormously effective. So do we want this to be over? Absolutely. But if we take the steps necessary, if there is a resurgence, these steps are looking like they were extremely effective.
Dr. Razak, always great to talk with you. Thanks so much.